Hello and welcome to the Arizona Center for Rural Health State Office of Rural Health's webinar series. I'm very happy to introduce this session as Overdose Prevention and Other Statewide Resources, Arizona's Collaborative Response. This is exciting. Heather Doss and Estefania Mendivil will be presenting, and we can go to the next slide. Before I turn it over to Heather and Stefania, I just want to let people know that everybody is muted because we're in a webinar Zoom platform, but we really encourage any questions or comments that you have. Please, you can add them to the chat box. And then I also wanted to let you know that after this webinar, the slides and the recording will be distributed via a listserv to all the attendees, as well as it will be posted on our Center for Rural Health website. With that, I'm going to go ahead and turn it over to Stefania for additional introductions.
Hello, everyone. I'm Estefania, and today I will be co-facilitating with Heather. I am with the Overdose Data to Actions state program, and I'm very thankful to be here today.
Hi, everyone. My name is Heather. I'm with the Arizona Poison and Drug Information Center, and I'm one of the community outreach coordinators. So I'm excited to share our information with you all today as well.
And so thank you, Bridget, for starting our session today. So let's start. Before we begin, we have no disclosures to report, and this is our disclaimer if you would like to read it. And before we start today, I want to invite us to remember that the University of Arizona stands on the ancestral and present-day homelands of the Tohono O'odham and the Pascua Yaqui peoples. And for millennia, these nations have cared for, protected, and cultivated these lands, the desert, its waters, and its sacred mountains, and they continue to do so today. And we honor their enduring relationship to this land and recognize that Arizona is home to 22 federally recognized tribes, each a sovereign nation with its own stories, governance, and resilience stories. And with deep care and responsibility, let us walk forward today in solidarity as the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education, partnerships, and community service. And these are our mission statements. Please feel free to read these. So I'm excited to introduce the Over Data to Action State Program, also known as OD2AS, and we're housed at the University of Arizona Center for Rural Health in partnership with the Arizona Department of Health Services and funded through the CDC. OD2AS unites community-driven prevention and harm reduction work. Our team focuses on two strategy pillars: clinician and health system engagement and harm reduction. We also offer bilingual trainings, county-specific resource cards, resource toolkits for community health workers, and community health representatives. And we are having a soon to be growing library of non-demand education materials and a resource hub website. You can check us out and read more on our website as well. And now I'll hand it over to Heather to introduce the AZ Poison Center.
Thank you, Estefania. So as she mentioned, I'm going to be giving some background on the Arizona Poison and Drug Information Center, which is probably better known as Poison Control for short. Our center is one of two centers here in Arizona, and we serve all counties in Arizona except for Maricopa County, which is served by our sister center in Phoenix. At our center, our phones are fully staffed by board-certified pharmacists who specialize in poisonings and envenomations. And we manage poisonings and envenomations. So for example, if somebody ingested something that they weren't supposed to, or ingested too much of something, or perhaps somebody was bitten or stung by something, those are the types of exposures that our specialists can manage. We also accept information calls as well. So for example, if somebody has a question about their medications, or maybe they want to know about the safety regarding a specific product or a specific substance, people can give us a call to have their questions answered and receive more information. Additionally, when people do call us at the Poison Center for their exposures, a majority of the calls that we receive are ones that can be safely managed at home with the guidance of our specialists. That saves people the time and the money associated with an unnecessary visit to the hospital or any other kind of healthcare facility. And then, like all poison control centers around the country, our center's services are available 24/7, 365. They're completely free and confidential to utilize, and we can also assist people in several different languages. And then lastly, the phone number for poison control, which you see on the screen on our logo, is 1-800-222-1222. This is a national number, meaning that it can be used from anywhere in the United States to reach a local poison center. So no matter if people, maybe they move out of state or they just travel out of state for some specific reason, they don't have to worry about saving or remembering several different numbers. They can always use the 1-800 number. And for more information on our services, you can visit our website and learn more about our resources as well. And we would like to start off this webinar with some questions, and we ask that you write the answers to your questions in the chat. And we'll start off with the first one. What's the best way that you get your information about statewide resources resources about OUD? And then I'll go ahead and read off this second question as well. How do you disseminate resources to people that you serve? And then our third question is going to be, why do you think people don't access resources? And again, if you have, if you want to share your information, you could write those answers in the chat box. Are you guys seeing anything on your end? Okay, I
So
see
it
some
looks
coming in
like
now.
the chat box isn't working, but the question and answer is. So if you could type them into the question and answer, that would be preferred.
I don't see anything quite yet. I do see a couple from our panelists. So I know people use word of mouth with family, friends, and coworkers. That's something that we also do here at our center. For example, when we post stuff on social media, we also post it on our or reshare it onto our own personal pages. Email dissemination is another really good one. You could do a mass email send outs to provide resources or providing things like newsletters, which I know both Estefania and I will be talking about as well. I'm going to go ahead and move forward with the next slide. So getting into our webinar, in 2023, the United States reported 81,083 opioid-related overdose deaths. While slightly down from 2022, it's still a staggering loss. Overall, about 17% of US adults, roughly 48.5 million people, experienced a substance use disorder last year. And it's not just opioids. The report also highlights ongoing misuse of both prescription stimulants and recreational stimulants like cocaine and methamphetamine. These substances carry unique risks, especially when mixed with opioids. Of the 8.9 million who misused opioids, nearly 1 million used fentanyl, and only 1 in 4 of those needing treatment actually received it. So all of this does reinforce why making accessible community-based resources available is very essential. And then talking about stigma. So stigma is one of the biggest barriers to care for people who use drugs. It's rooted in outdated beliefs, like the idea that someone's substance makes them dangerous or immoral, and it shows up in how people are treated, talked about, and even how policies are written. We know that providers with more stigmatizing beliefs are less likely to refer patients for treatment, and nearly 40% of people who use drugs avoided care this past year, mostly out of fear of being judged. But stigma is something that we can shift. We do that by leading with care, choosing words with intention, and making every space feel like a safe one for everyone.
So why accessible resources matter in the rural landscape? Rural communities are often overlooked in conversations about overdose, but they're just as impacted. And in 2020, the overdose death rate in rural areas was 26.2 per 100,000, nearly the same as 28.6 in urban areas. And here in Arizona, 11.5% of our population lives in rural areas, and those folks are more spread out than the national average, just 56 people per square mile compared to the 94 nationally. That may not sound like much, but it is a big impact. And people in rural communities often have to travel farther, have fewer local providers, and have limited to no public transportation. So even if someone wants that support, it may not be there when they need it. And that's why accessibility is so, so, so important. And getting resources into rural spaces before a crisis occurs can change someone's outcome and save their lives. And so here's the most hopeful part. 73% of US adults who've experienced SUD say they're now in recovery. And that's really powerful. And recovery is not rare. It's real and it's happening. But to get there, people need tools, support, and clear pathways. And that's why the work of making resources more visible, accessible, and community rooted is so essential. It's how we help recovery become a reality for even more people. So how do we respond to everything we've talked about? Rural gaps, stigma, treatment barriers. We start with resource readiness. And when materials like hotlines, naloxone kits, or peer support contacts are already in people's hands, they can act in a moment of need. And how do we share those tools matters as well. Clear, culturally relevant, and visible materials go a long way in building trust and saving lives in our communities. That idea of resource readiness isn't abstract for us and guides everything OD2AS puts in the communities and in your hands. And here's what you can start using right away from our resources. Our county resources cards for rural Maricopa, rural Pima, and Cochise counties put SUD treatment hotlines, mental health supports, naloxone pickup sites, and other extremely important resources right into people's hands and pockets. We also offer no-cost bilingual trainings, virtual or in-person, covering overdose recognition and naloxone administration, the 2022 CDC prescribing guidelines, and polysubstance use. And if you're interested in a training, you can also scan the QR code to submit a training request form, and we'll set up a session for you in your org. Also, we have on-demand CE eligible trainings coming soon, and one example topic is self-care strategies for healthcare professionals. And we're also including all the QR codes in the chat. And we've also built a living resource library designed to support both the people we serve and your own well-being. And here are 4 highlights of our resource library. The first is culturally responsive care and prevention programs for Native American communities in Central Arizona. This highlights available services for Native American communities addressing opioid use disorder and behavioral needs. It includes access to culturally relevant care, community prevention, and treatment programs offered by tribal and urban health centers. Second, we have our wellness resource for community health workers and representatives, which offers self-care strategies for those who witness or respond to overdoses. It includes guidance on managing stress responses, building support networks, and accessing mental health support to promote resilience and well-being. Third, we have our loneliness and substance use disorders toolkit for CHWRs, which offers evidence-based insights on how loneliness and SUD interact, brief screening tools, and ready-to-share directory of crisis lines, treatment services, and peer supports to help CHWRs intervene early and foster social connection. And lastly, we have our stimulant resource reference, which is a plain language resource that's just a one-pager front and back on current stimulant trends, harm reduction strategies, and treatment. So beyond these resource flyers, we also highlight the HEAD Resource Hub, which is a wonderful site, and it's Arizona's statewide directory focused on advancing health equity. And we also have our OD2AS monthly resource bulletin, as I mentioned. And you can find these resources on our website, which is the link on the side, and it will also be dropped in the chat as well. And if it's helpful, once you're on our website, you can scroll down to the accordion or the little pull down tabs, and you find the resources for CHWR's title tab, and you click it and it'll pull all that stuff down. And so to make finding resources even easier to navigate, we're building a searchable website that houses 500 plus documented resources that I've slowly started compiling over the course of a few months. And you'll be able to filter by county, Medicaid versus non-Medicaid coverage, and where each resource sits along the Surgeon General's SUD care continuum, which is prevention, harm reduction, treatment, recovery, and health promotion. And you'll be able to find naloxone distribution points by county as well on there. And so the screenshot on the slide is just a sneak peek as we're hoping to launch by early fall. And if you'd like a launch alert, just drop your email into our resource bulletin sign up link that we've shared in the chat as well. And with that, I'm happy to hand things over to Heather for the Arizona Poison and Drug Information Center to share the life-saving services that they bring to this work as well.
Okay, shifting gears a bit and talking about what our center does in addressing SUD and OUD. We do this in lots of different ways. So first, we work to establish and maintain partnerships with various community organizations to provide education and materials. So that could be things like community organizations, any kind of public safety enforcement agencies, things like that, anywhere where our education and materials would be of value. Second, we do a lot of community outreach and community education. So I, along with our other community outreach coordinator, we provide a majority of the public-facing education for our center. This means that we provide presentations for various groups at various locations. This could be public safety personnel, again, schools, universities, churches, community centers, really any kind of group or organization that wants a presentation or wants to learn more about Poison Control Center and what we do, we'd be happy to provide that. And we can provide presentations on various topics related to poisonings, including substance use and opioid use, and then safety related to that as well. And then if anybody wants a presentation on a topic that's more clinically based, one of our pharmacists or physicians can go and provide that as well. Next, as I previously mentioned, our specialists manage calls from healthcare professionals who care for patients. So our pharmacists, toxicologists can provide further treatment recommendations for the patient. And then lastly, we also help manage the opioid assistance and referral line, or the OR line, which I'll speak about in the next slide. So to provide more background on the OR line, this is a service that's made available by ADHS, the Arizona Department of Health Services, and it's managed by our center and the Banner Poison and Drug Information Center up in Phoenix. The OR line provides opioid-specific information, resources, and referrals to the general public and healthcare professionals. So like the poison helpline, the OR line is available 24/7, 365. And services are also completely free and confidential to use as well. Specific information that our specialists can provide through the OR line includes information on opioid safety. So that includes safe use and how to reduce the risk of overdoses. where and how to obtain naloxone and how to administer it. And then we can also provide referrals to treatment programs and chronic pain providers. And then we can also provide consults for healthcare professionals who, again, provide patient care in healthcare facilities. And then the number for the OR line is the one that you see in red on your screen. It's going to be 1-888-688-4222. And then on the QR code there, you can find out more information on the OR line. And then so here, I just wanted to provide some examples of questions and information that people can call about and what type of information we do provide. This, of course, isn't an all-inclusive list. These are just some examples. So the first one being that we've had a call from a person who was looking for an in-treatment patient facility for a family member. Our specialists were able to provide contact information for various facilities in Tucson. And we could provide, if, for example, somebody was in a different city, a different county, our specialists could gather information on treatment programs and then provide that to the caller as well. Then we had someone ask how to dispose of opioids. So we discussed take back programs with them, drop off boxes, and then we of course discouraged flushing. And then we mentioned that they could also consider mixing with unpalatable items as well for safe disposal at the home if they couldn't get to drop off locations. We've also had people who wanted to know where to obtain Narcan. And we were able to provide locations that provide Narcan per the Sonoran Prevention Works website. And then we also recommended them to check with their local libraries. Oftentimes, libraries do have a stock of Narcan that is available to the general public. And then, of course, health departments may have access as well. And then just some other questions. So we've had people who wanted to know if methadone could be prescribed by their doctor for chronic pain. And then we also had a healthcare provider who was looking for a treatment program specific for an adolescent patient. So we were able to provide recommendations based on the specific needs of the patient or the caller as well. So just to summarize, these are just some of the examples that our specialists have managed. And again, that information can be provided based on the specific needs of our callers.
And Heather, we had a question come up from Melissa about Datura bags and if you provide those.
We do provide those. So we provide them at our community outreach events. Typically, though, that's the only way that we're able to get them out to people when we participate in health fairs or if we have any kind of presentation that we're doing that's specific to medicine safety or opioid safety. We will bring those with us and hand out to attendees as well. Okay, I think, is that all the questions? Okay, perfect, thank you. And then lastly, I also wanted to share a little bit about our opioids training titled Opioids in You, Opioid Recognition and Response. So this training provides a background on opioids and opioid use disorders. In it, we also discuss the signs of an opioid overdose and the steps to take when responding to that overdose. And then we also provide a demonstration on how to use the 3 forms of naloxone. So that would be the nasal spray, the injectable, and then the auto injector. This training is available on demand on our website. So if you go to our website, azpoison.com, and then click on the drug information tab, it'll be on the left sidebar menu of that page. And then if you are completing the on-demand version of the training, we do ask that the pre and post surveys be completed for that as well. And then we also do offer this training in person. So if somebody wants to have this training in person for their organization, they could just reach out to me and we could coordinate that and we'd be happy to go to their location and provide this to them. Okay, so following all this information from the Poison Control Center and OD2A, we want to share a few best practices for getting these resources out into the world, especially in ways that feel approachable, relevant, and rooted in real community life. So first up, we have social media. This could be short, direct posts, especially ones that link to PDFs or a page with local support information. This can make a big impact. So you can use things like Facebook, Instagram, WhatsApp groups. These are all tools that can help get information into people's hands in a matter of seconds. And then another way to increase social media outreach or reach in general is to collaborate on campaigns with various community partners, such as health departments or any other kind of organization or coalition that's active in your community. And participating in social media campaigns like this can help bring information to new audiences, so then new audiences could be aware of your resources and utilize those as well. And these campaigns could be done on a regular frequency or on any kind of timely basis as needed. Nacho's website, their social media toolkit is a great starting point, and it walks you through building a strategy that feels consistent, engaging, and is also aligned with your mission. And then social media, although it's one of the big ways to get things out into the public, it's just one path. So there's other things we can do. One of the most powerful ways to increase reach is through partnerships with community organizations. So for that, we can think of local coalitions, mutual aid networks, food banks, schools, faith-based organizations, anywhere that people are already gathering and already trusting. And when someone receives a resource through a familiar, trusted place, it's more likely to be read, utilized, and shared with others as well. And then, of course, there is the power of libraries. So libraries perform essential functions that stretch far beyond just being a place where people can read and obtain books. And they also have the unique advantage of also being a trusted source within our communities. Um, People can visit libraries to access free internet and computers. They could also go to these places to participate in programs and events, or for free assistance with things like resume writing and job searching as well. So essentially, it's a hub of lots of different information, lots of different resources. And then they also serve as third places as well, which are places that are not someone's house, work, or school, where people can gather, socialize, engage, and just build relationships. Um, and then another thing to consider is that libraries also serve as a safe, weatherproof space for our vulnerable populations as well. We've seen libraries continue to serve as safe, non-judgmental, and deeply community-centered spaces. So whether it's doing things like setting out flyers, having naloxone available at the front desk, or offering public programming around harm reduction, libraries are a hub. And if you're not already collaborating with your local branch, this could be a great time to start. The network of the National Library of Medicine's Community Engagement Guide includes a template and guidance for library-based outreach, especially when working with low-tech or no internet areas. And then speaking of libraries, we just wanted to highlight the Midwestern Public Health Training Center, Public Health and Public Libraries Collaboration Toolkit. So this toolkit was developed by the Midwestern Public Health Training Center in partnership with the network of the National Library of Medicine, the Public Library Association, and the Prevention Research Center for Rural Health. And the toolkit is basically a PDF that includes lots of information related to partnering with libraries, including how libraries can support public health, how to get started with establishing those relationships, and how to evaluate those partnerships as well. And in addition, the toolkit also provides links to podcasts and webinars that delve more into this topic.
Unmuted. Thank you, Heather, for all that information. It's absolutely wonderful. So to build on what Heather is saying, getting overdose prevention resources into the right hands begins with honoring the everyday lives and communication habits of the people we serve and are in community with. So first, a multi-channel approach matters. The Rural Health Information Hub points out that campaigns repeating the same core message across social platforms, printed handouts, and broadcast outlets consistently reach more people and drive measurable behavior change. In other words, the more outlets we offer, the more chances someone has to see the information at that right moment that they need it. Yet digital is one lane, as Heather said, and for many, it's a closed road. SAMHSA calls reliable internet access a super determinant of health because it shapes every other determinant from employment to medical care. Nearly 19 million residents, most in rural or high-cost areas, still lack dependable broadband, and millions more use basic phones without data plans. And if we rely on social media or internet alone, we can unintentionally exclude people waiting at a laundromat that has no Wi-Fi, people whose phones can't open PDFs, or folks whose workload leaves little time for scrolling or sitting on the internet. And that's why print materials remain vital. A flyer on a clinic bulletin board or a tear-off card at a local grocery store can travel far beyond a hyperlink or a QR code. So paper doesn't require a password, a charged battery, or a strong signal, and it meets people on their terms during a grocery run, a library visit, a walk to the park, or a Sunday service. So finally, radio public service announcements are a proven force multiplier. Local stations set aside airtime for community messages, and many will broadcast 15 to 30 seconds to 1 minute spots for no cost or little to no cost. It really depends. And so think about the person driving along rural road or the grandparents listening while making breakfast. A radio turns a single paragraph of copy into hundreds of impressions each day. And that's super important and powerful. So let's weave these strands together. So scheduling social media posts, place printed resources in trusted spaces, scripting a concise radio PSA, and by layering channels and respecting the very real barrier of limited access, we ensure life-saving information reaches every person who needs it and not just the ones who happen to be online. So how do we make the digital lane work for everyone? SAMHSA's blog, Digital Access, a Super Determinant of Health, gives us some insights and resources. And the good news is that this resource curates a list of programs we can plug the folks we serve into that need it. So for example, one of them being Lifeline, a federal program that gives people from eligible households a monthly discount for phone and internet services. Next, everyone on.org, which allows you to type a zip code and see every low-cost plan and refurbished laptop in that area. And this resource also links the FCC National Broadband Map and the Mapping Broadband Health in America tool. So you can input an address, overlay health outcomes to target, and also know where digital deserts are. So that's a really cool resource as well. So language is connection, and connection saves lives. In Arizona, more than 1/4 of people 5 and older speak another language other than English, most commonly Spanish and Navajo. And research backs what community members already know. When patients can't read or hear health information in their preferred language, they are less satisfied, less likely to follow treatment plans, and more likely to experience preventable harms. A large systemic review found that professional interpretation and language concordant materials sharply improve comprehension, utilization, and even clinical outcomes for adults who are limited in English. But the challenge doesn't stop at language. As I mentioned in my previous slides, digital access is now considered a determinant of health. And SAMHSA notes that 19 million people nationwide, many in rural zip codes, still lack reliable broadband, as I also mentioned before. And if our multilingual materials live only behind a high-speed internet connection, we're still leaving people behind. And for a powerful local example, I really want to highlight mobile outreach vaccination education for underserved populations, also called Move Up, created under the University of Arizona's AHEAD initiative and led by Dr. Cecilia Rosales. Move Up brought vaccines and bilingual Spanish-English education to people who would otherwise be missed. And by eliminating transportation hurdles, on-site registration barriers, and language gaps, the team demonstrated how culturally and linguistically tailored outreach can raise uptake while respecting labor schedules and community rhythms. So translating and co-creating every vital resource into primary languages of the community, print and place those translations into trusted physical spaces, and when possible, bring the service itself to the workplace, just as Move Up did. And by layering language access with low-tech delivery, we ensure life-saving information is still reaching every person that needs it, and it's not just the ones who have the internet access. And plain language is also very, very important. Plain language is more than just good writing, it's health intervention. And only about 1 in 8 adults, and that's 12% nationwide, can easily navigate medical information. And when we swap out technical terms for everyday words and keep sentences short, we unlock comprehension for the other 88%. Plain language is an equity tool, and studies show it lowers barriers for people with limited literacy or limited English proficiency, giving them a fair shot at making informed health decisions. So whether you're drafting a flyer, a web page, a text message, or a newsletter, aim for words that anyone can grasp at a first glance, and clear language saves time, builds trust, and saves lives. And so following this, we recommend the ADA Trust Language Access Toolkit if you need to create or translate outreach materials. This is a really amazing toolkit, and it shows you how to plan translations and secure interpreters, a plain language checklist to keep text clear, and key legal rules for serving limited English speakers in Arizona. So you can scan the QR code or grab the link in the chat. And here's another recommended resource. If you want a fast, evidence-based way to check the clarity of any handout or any resource material you create, we recommend using the CDC's Clear Communication Index. It's a 20-question checklist that scores your material and pinpoints anything you may need to change. Again, you can scan the QR code, or the link is also in the chat.
All right. Thank you, Estefania, for talking about all those different practices for disseminating resources and sharing those resources that do exist. So now that we've talked about all the different ways to disseminate these resources that we might have, we'd like to share how our organizations share our resources. So I'll be talking specifically about how we at the Poison Center do that. So one of the first ways that we do that, and most recently what we started doing, is establishing partnerships with our local libraries to provide presentations, host tabling events, and participate in their regular programming, where we can provide education to the library patrons. Next, we also have our newsletter, the Poison Prevention Script. And through our newsletter, we provide information on topics related to poisonings and envenomations. And we highlight our resources and the work that we do in the communities that we serve. Additionally, we also take advantage of networking opportunities by making connections at health fairs, conferences, and any other events that we might attend, and then also continually seeking new partnerships in the community. So every so often we might do just go on the internet and search for any active coalitions that are in the communities that we serve, any organizations where we feel that our information would be valuable for the group. And then lastly, we also just use various different streams of dissemination, including social media, and then including package inserts in packages when we mail materials to people who request them, staying in regular contact with community stakeholders, conducting mass mailings of things such as our annual reports, and then participating in media interviews as well.
Thank you for sharing, Heather. And so here at OD2A, this is how we move our overdose prevention tools from desktop to the community's hands. So first, we do radio PSAs in English and in Spanish, running on AZPM and KNAU, catching listeners wherever the radio is on. And second, every toolkit and flyer that we have lives in both digital and printed form, with most materials available in English and in Spanish. And third, a monthly resource bulletin, which is a newsletter, lands in CHWRs and partners inboxes. And lastly, we also do hand materials at conferences, at tabling events, and slip them into attendees' resource bags and send them to partnering programs so they can share them with their networks as well.
And then if you're interested in learning more or building your own strategy, there's still a few more amazing resources that we can recommend. So one of the first ones being the National Association of County and City Health Officials. Their social media toolkit gives a step-by-step guidance for crafting thoughtful and accessible posts. Next, we have the Rural Health Information Hub Dissemination Toolkit, which offers tips on flyers, media partnerships, webinars, and more, especially with a rural focus. And then the next slide, please. And then we also have the Network of National Library of Medicine Guide, which focuses on community engagement and outreach tools for libraries and other public-facing spaces. There's also the Agency for Toxic Substances and Disease Registry, and the CDC's Health Communication Playbook, which walks you through how to create materials that resonate. Plus, they have a really helpful section with evidence-based recommendations for what works best. And then finally, we also have the University of Kansas Community Toolbox. This is a free resource center with over 300 practical topics on program implementation, evaluation, and community organizing.
So disseminating resources isn't just about pushing information out, it's about weaving care into everyday spaces. And it's about making sure someone can come across help without having to ask for it. And it's about recognizing that public health lives in grocery stores, community boards, laundromats, library shelves, parks, and not just in clinics or websites. And we call you to keep sharing what we know, and so that no one feels like they have nowhere else to turn. So thank you so much for everyone who came to share space with us today. And before we close out, we're going to poll everyone on just a few questions regarding your experience today. If you don't mind doing that for us, please.
And then thank you again for attending today's webinar. So as a reminder, we will be sending the recording and the slides to participants. And for additional resources, we recommend to look at our cited sources in the slides notes. And then again, just as a reminder, as Estefania mentioned, that poll that you probably see on your screen, we would like you all to complete it. So to get your feedback on today's session.
And thank you everyone for answering the poll questions. If any questions come up after this is over, please don't hesitate to reach out to Heather and I. We're more than happy to be in conversation with you guys. And if you have any resources you would like to share or have be shared on the OD2IS resource newsletter, please send that over to us as well. We're more than happy to just share around the information that is needed. Thank you, everyone.
Right. See, Veronica is still with us. Veronica, did you have any questions or anything that we might be able to help with? They may have had to step away. I'm gonna go ahead and remove Veronica. Oh, there. Perfect. All right. Well done. That was great. It was really, really good.
Thank you.
Thank
Thank
you.
you for helping.
Yeah, so good. Yeah, you guys did a great job. Well organized, succinct, and thorough at the same time. So, and very inclusive. I think I loved the terminology and the language you used to highlight the strengths of our communities. So I really appreciate that.
Thank you, Bridget.
Yeah,
Thank you.
Thank you. Were you able to see the poll results?
Yeah,
Okay.
Mhm.
I think
Good.
everyone answered.
Yeah, we got 100%. We had 6 people that attended. It looked like a couple had to drop out or do some other things. And so we got 4 people and we got 100%. So let's see. Yeah, and it looks good. Yeah, looks really good. So that's good. And I don't know, I think this gets automatically saved into Zoom that we can then use.
Yeah, I think so.
Okay.
Hopefully. Download results. You can download results.
Oh, where's that?
If you go back to the polls and quizzes main, you can put download results. I can just download it and I'll send it
Okay.
over to you.
Beautiful. Thank you.
Mhm.
All right. Is there anything else that we need to do or discuss or?
I don't think so. I think that I'm excited to have it recorded and shared, and I'm gonna try to work on the resource 1, 2, maybe 3, 4 pager. I think this is a really good topic to have also existing.
I agree. Yeah. And should definitely do it again and figure out the best place to situate it. And if it's, at the State Office of Rural Health, or if we want to think about other venues that we might be able to present that, because I think it was really well done.
Thank you. Yeah, I
Yeah,
agree.
great job and appreciate I love all the links you had. I'm like, wow, I want to do that now when I present. I want to provide more links. So you guys did an amazing job.
Thank you.
Thank you.
All right. Well, have a great rest of your afternoon, and we'll be in touch soon with additional follow-up.
Yes.
All right. Great. Thank you.
Thanks, everybody. Great work.
Bye-bye.
Thank you,
Bye.
Heather.
Thank you.